to say at each class, and I always like to start them with this point, because ultimately I can give you all the knowledge, but once again, if you don't move from where you are, then it's all for nothing. And Jim and I had a conversation that was what I thought fitting, because Jim gave his testimony up here the first night. And from that, though, I had said to you when you just came in my clinic and we were re-looking at your numbers, which, by the way, just keep getting better and better. Your eye doctor, your medical doctor, they're both absolutely stunned, and they just keep telling you, whatever you're doing, man, keep doing it. They can't believe what's happening. And you can say a little bit about that, but the thing that you had said struck me, because I asked you the question, Jim, what did it for you? What did it for you? And, of course, you said, man, this changed. And I said, but Jim, here's the thing. Jim was going along in life thinking everything was fine. And if I would have came to him with this diet, how long ago? Whatever amount of years ago, he would have said, I'm doing fine. But guess what? Jim, all of a sudden, one day, bam, the bottom fell out. And he remembers the day. Tell us about that day.
Absolutely. Yeah, I was actually at a Steeler football game. And
is that working?
We were jumping around, having a good old time, and the Steelers were winning. And all of a sudden, my eye, I couldn't see through it. I started to see black lines in front of my eye, and it looked like somebody had put a fingerprint over top of my eye. It was on December 19th of 2003. I know exactly what day it was. And, my wife had been telling me all along that, you should do this, we should do this, we should not do that, we shouldn't be doing this, and, yeah, right, no big deal, But that moment, I knew something was wrong. When I went to the eye doctor, he told me that two things cause your eyes to go bad the quickest of anything. Your glucose, high blood sugar, and your blood pressure. Those are the two
Inflammation.
Right. And he said those two things will cause your eye to do negative things, which is what was causing my eye to do exactly what it was doing. We tried for 3 years to just monkey around with laser surgeries and do some things, but the last time it happened, he flat told me, that's it, we're going in and do an operation. And the operation is actually unique, that they can take the fluid out of your inner eye, and that's what they did. They took all of the fluid out of my right eye, which allows me to see. But every time I go to the doctor, he takes my blood pressure. Blood pressure the last time, normally my blood pressure when I was going to the doctor was somewhere in the neighborhood of around 160, 170 over about 95. I went to the doctor this last time, and he said, whatever you're doing, just keep doing it. I was 126 over 64.
Well, let me ask you this, though. Before that Steeler game, you didn't have any of those problems.
Absolutely not. I had some trouble with my left eye, but it was no big deal.
Right.
But I was fine.
Yeah.
I was going along.
No problems.
Was great,
See, and that's where most of you are right now, and that's why I wanted to tell him this story, because, now, see, just like in Andy Stanley's book said, now once your back's against the wall and the bottom's falling out, now, Jim is willing to do what it takes. But the point is that I want to also bring up is he has permanent damage. In other words, there's things that are never going to reverse, and he recognizes that, but now he's just trying to hang on. But the point is, how many years ago, if he would have heard this and implemented it, then he wouldn't be where he is right now, you see? And that's what I want you all to get from this, is don't wait to where he was. And that's the point, because one day you're going to have a Steeler game phenomena of your own, where you're just going to all of a sudden be walking down the street, and bam, it's going to hit you. 54% of all heart attacks happen without any symptoms whatsoever. All of a sudden, you're just gone, and 54% of those people just die. So 54% of the people who die from heart attacks had no symptoms at all, and then they're dead. So that's what you have to keep in mind.
One thing with this diet, though, that's helped me is that one of the other things that was going wrong was I had no feeling in my feet. The doctor told me that because of everything else with my diabetes, that I would have to wear shoes all the time. Don't walk around, because if anybody drops a glass and there's a sliver of glass there, you could cut your foot and you wouldn't even know it. And I didn't. Now, with this diet, I'm starting to feel I have feeling in my foot. They give you, when you go to the doctor every once in a while, they give you this little wee red needle that they keep jabbing in your foot to see how much of that you feel.
Right. which they thought would never return, by the
Right.
way.
Half of my foot, I couldn't feel anything. And she's saying, well, maybe you can get this, maybe you can. She's jabbing me, and I'm telling her, yeah, I can feel that, yeah, I can feel that. She said, how can you feel that? You couldn't feel that the last 3 months you were here. Now I can feel where she's pulling around. So all of it is not always gone. I mean, it does come back, but I wish I would have known a whole lot about this a lot sooner.
Thanks, Jim. Appreciate it. Yep. Give him a hand.